Good morning, everybody. I'd like to introduce Dr. Maurice Goodman, the Chief Medical Officer from Discovery Health. Welcome, Maurice.
Hi, Suraj. Thanks for making the time. I appreciate the opportunity.
Thank you very much for taking the time to be part of the channel. I'd just like to introduce your background for those people that may not know you. So you've done an MBA and you worked with the South African healthcare practice for a leading international consulting organization before moving into healthcare funding. And you joined Discovery Health shortly after its inception. So I think you were part of the originals. And you're currently a trustee for the Discovery Foundation, which invests in excess of 300 million in the training of medical specialists, which is amazing. You're also a trustee of the Discovery Fund, which is dedicated towards improving individuals' quality of life through provision of primary care in indigent communities. You serve on various committees, such as the WITS Business School and the Medical Advisors Group. And you're the current vice chair and immediate past acting president of the convocation of the University of WITS. You also serve on the WITS Council, and you're the branch councillor for SAMA, the South Gauteng branch, and you're a member of the SAMA Human Rights and Law Ethics Committee. So we are very privileged to have such an esteemed guest and experienced innovator, an entrepreneur, if you want to call it, in the digital health space.
Thanks, Suraj. Yeah, well, Adrian's always encouraged entrepreneurial behavior within a corporate, which isn't easy to achieve, but it's certainly, I think, been one of the things that we've encouraged within Discovery. And yeah, we like to be entrepreneurial, even in a big corporate.
And I think that corporate-preneur mentality that yourself and Adrian sort of instills through the organization, I think is reflected in a lot of the product development, which one is responsive, quick to market, and normally big corporates don't do that. They wait 2-3 year cycles, benefit design cycles before they implement. Whereas I think with Discovery, and you'll go through your presentation now, you can see your response is exactly what an entrepreneur would do. It's very agile.
We try to be positively disruptive. Of course, it does bring with it challenges. You know, leading isn't easy. The initial barriers that one needs to overcome, but at the end of the day, looking back at our track record, I think we can say, you know, it's been the right way to go, and we hope to do more of that going forward.
So yeah, I think what we want to share with the audience is what has happened in terms of digital health adoption during the COVID period, and I think the way forward for Discovery. So I think you've got an amazing presentation which you can share with everybody, because I think the insights is going to be surprising for a lot of people who did not know the extent at which Discovery really sort of reached out and looked after its membership. And broader, actually.
Thanks, I'll go through this, and please feel free to interject at any stage. But I think we've seen digital health, telehealth, telemedicine from many years ago. We've recognized that it's important enhancement that enhance care both for our members and much more broadly, quite frankly, for all the people of this country. As you mentioned in my introduction, I am involved in a number of our CSI initiatives, and being a powerful force for social good is an important element of what we try to do here. So the things that we're doing and we're talking about, obviously targeted at the members of the schemes that Discovery Health manage, but more broadly for South Africa as a whole. So I think let's keep that in mind as we go forward.
Great.
So maybe, yeah, if we can kick off with, sorry, Suraj, you can.
No, we can start with.
So if we can kick off, I won't spend a lot of time on this. There are many papers and much research that's happened globally and locally that shows that telehealth or virtual health is certainly on the up. It's being embraced by doctors and other health professionals. Very interestingly, as pointed out in this Stanford paper from last year, although doctors, both students and qualified and experienced doctors, do embrace digital care and virtual care and telemedicine, they do recognize, in fact, that they need training and support in order to embrace this technology. And I'll talk to that in a later slide. And as you mentioned up front, globally and particularly in South Africa, virtual care, telehealth has been kind of ticking along. But came COVID and the pandemic, and there's been a significant escalation. As I'll just show some data in the next slide from our own data. So that's what happened in terms of consultations. I've just used general practitioners, family practitioners, and pediatricians as an example, but it was really mirrored to a greater or lesser extent across all health professionals, a significant drop in face-to-face, in-person consultations. But as you can see on the bottom part of the slide, there was a mirror image, the opposite impact, with a significant uptick in the number of virtual consultations that happened across the schemes that we administer.
And would you say that the surgical practitioners, the gastroenterologists, the orthopedic surgeons, their drop would have been more severe versus a pediatrician? Generally, if a child's sick, you still figure out a way to get there. But with elective surgery and those type of specialist cardiologists, would the drop have been more than the 30%?
Interestingly, it was initially, because as you said, everything except emergency surgeries were cancelled. But interestingly, the surgical disciplines, the in-hospital admissions have recovered more quickly than have the medical disciplines. But there has been a return to normal, and in fact, in some cases, a reversal. I mean, it's probably not the topic for today, but we're very concerned of a kind of post-pandemic surge in consultations and procedures that were pushed off.
Sure.
And in fact, I haven't included a slide here, but we've seen a significant drop in the screening, mammograms, pap smears, etc. And so there's a bit of a concern about the buildup of those diseases and what that's going to do. And in fact, we've already started seeing a reversal in some of those trends. But in the early part of the pandemic, and still there was a drop in the face-to-face interactions and kind of concomitant build-up in the virtual interactions. We recognized that we needed to do a lot to help the members of the schemes we administer, as well as the doctors and the other health professionals that care for them. And so we put in place a number of things to doctors are people too, and they need to be looked after. And besides the drop in their consultations, there's been huge stress, as you know, as well, or better than I do, on the health professionals, indeed on all healthcare workers. So we put in place a range of support services to help them physically, mentally, for their practices, private practices that had to perhaps retrench staff, etc., because drop in revenues, legal support, etc. Also supported them, making sure in those days there wasn't a COVID vaccine, but that they got their vaccinations, isolation, hotel benefits. But if you look at the central part of the slide, we did a lot to promote virtual consultations. So there were already virtual consultations happening on the Discovery platform, but we really reached out to our members and to doctors, in fact, to promote the use of virtual consultations. And together with Vodacom, we reached beyond our members, and between the two of us, we funded 100,000 COVID virtual consultations for any member of the public. Once again, trying to reach out and support the country as a whole, in addition to our membership. We encouraged the family practitioners to reach out again proactively to make so-called virtual house calls. They have lists, obviously, of their members or their patients who are living with chronic illness, and we funded proactive virtual house calls to make sure that those patients who now were they were worried about COVID, they didn't come in for their regular checkups, for their hypertensive, diabetes checkups. So we encouraged and funded virtual consultations with those patients. Also, members who had been for a vitality health check, we proactively check for various parameters. Any of those parameters that were out of range, if the blood pressure was elevated or the cholesterol, etc., then once again, we encouraged and funded a virtual follow-up with a family practitioner to make sure that if there was something brewing, the doctor could actually pick it up and treat it early. So those were a few examples of what we did to actively promote this virtual platform during the period. We also did a range of other things, just two that I'd like to talk to. Of course, COVID is a novel disease, both in the first wave and then in the second wave. And so together with SAMA and UFFP and SAPIF, we put on a range of webinars and podcasts to featuring local and global kind of opinion leaders and clinicians, experts, to make sure that our health professionals kept up to date with the latest in COVID treatment. And then, interestingly enough, Henley Business School, recognizing the importance that virtual care is going to play going forward, they actually approached us, and we helped them put together a virtual healthcare course. They've run the first course now, and they're opening up for the second. To, in fact, as was highlighted in the first slide in Stanford, doctors and other health professionals need assistance to embrace this virtual care. So we've worked with them to provide those kind of courses, and we see more of that happening going forward.
So you basically enable the doctors, and now you're empowering them as well.
It's very important, Siraj. It's one can't just say, well, start doing virtual care. One recognizes there is hand-holding and support that's required.
Sure.
So if we look at this picture, I mean, a point that we do need to emphasize, that we never see virtual care kind of replacing, the face-to-face or physical care. I'm still from the old generation of doctors who remember statements like, if you don't put your finger in it, you'll put your foot in it. And, all those kinds of things, which I'm sure we all are well trained at medical school. And so, the concern that, the legitimate concern that maybe in a virtual environment, one may miss certain signs that one would pick up in a face-to-face environment, those concerns are real, and they need to be addressed. As I'll show in the next slide, the virtual environment is catering. No, I don't want to go there yet, but the virtual environment can cater for that, but we never see virtual care replacing face-to-face care. So the discovery model, which is one of a shared value model, we partner with the profession and with other organizations that can add value, stressing behavioral change. As you know, the tsunami of non-communicable diseases is driven mainly by poor behavioral choices, and if one can influence that, one can do a lot to prevent and manage diseases, and proactively encourage teamwork, also including the patient, in terms of a team-based approach to care. So that's really our model. And if you look at the bottom axis there, we've been providing that in terms of physical and face-to-face support. What virtual care now empowers that through remote monitoring. One can do coaching, nurse educators, etc. One can do a lot through a virtual platform to the patient, using remote monitoring then to, and there's an increasing range of devices that you can monitor almost any physical symptom at this stage or sign, feed that back to a data bank, use artificial intelligence where necessary to interpret that information, and then feed it back to the multidisciplinary care team and get that kind of virtuous cycle going.
So if I understand what you've said now is through the use of IoT, Internet of Things, your devices, your strong business analytics and health analytics components, would you say that the future of healthcare provision will be the blend of in person for certain type of conditions, and for a large majority of follow-ups, you will prefer to go and retain the virtual options because it's you can reach your patients more conveniently. They don't have to spend time off work. They can if a lot of people are working from home these days. So would you say that your membership is now more comfortable with follow-up care through virtual, and it probably will persist?
I think so, Shiraz. I'm not sure in terms of when you say the majority will be virtual. I think, you know, one needs to get a bit more granular than that. In certain conditions and certain situations will lend themselves more to a virtual environment, and some more to a kind of physical environment. But your statement about the future being a blend of the two, that we use the best of breed, we take the best that both can offer and blend those together, certainly that provides for the patient and for the doctor the convenience that you talk about, as well as the kind of safety. And using artificial intelligence, there was a great talk I saw, you know, radiology was one of the first disciplines to embrace artificial intelligence. And a number of radiologists were concerned, you know, would they lose their jobs? And I saw a great quote that said, you know, artificial intelligence won't replace radiologists, but those who embrace artificial intelligence will replace those who don't. Yeah. So I think it's kind of, you know, it's not a replacement, it's not a panacea, it's another very, very valuable tool that doctors and other health professionals can use to enhance the care that they're delivering.
Yeah, that's true. I mean, I think people get intimidated or fearful of the word artificial intelligence, you know, the whole Terminator analogy that, you know, it's going to replace humans. And we find that there's a lot of activity, especially within healthcare, around AI. I know there's another company that we interviewed called Autoscriber, which uses natural language, which I think is one of the toughest things for a healthcare provider, is to record, you know, the consult and the notes associated with that and the time it takes to do that. My father was a doctor and used to have his little recorder and then give it to the secretary to kind of type out his notes. And I think with your scale of data that you're collecting, it's impossible for somebody to crunch the numbers on Excel and pivot. You need the ability to use predictive analytics, be able to use that big data.
100%. And, you know, in disciplines such as oncology, I mean, you know, with the amount of new information and new drugs and, you know, personalized medicine, you know, it's really impossible for a human to kind of keep up with all that. But if you have, as you say, artificial intelligence systems crunching that stuff in the background and delivering it to the doctor in a form that they can use, you know, the combination of the two is just that much richer.
Great.
Yeah, so I think then just that's the kind of macrocosm. Then if we zoom in on, you know, one or two components of that, as we've talked about, an electronic health record is really a key to all of this. And the important thing is to recognize that there's both a provider or a health professional as well as the patient or the member. And increasingly, you know, it's important to embrace the member as a participant in their healthcare team. Again, the kind of paternalistic approach to medicine where the doctor kind of tells the patient do X, Y, and Z, and the patient humbly goes away and does it. I think that's being replaced, as I say, particularly with the growth of non-communicable diseases, where the patient And behavioral change is a critical component of managing that. To recognize the patient as an active participant in their care team is critical. So really to try to build that partnership. So for the doctors, we provide obviously a view of the patient record, but also very importantly, again, historically doctors haven't had a view of their whole population. They've really kind of tended to deal with, with patients on a patient-by-patient basis. And what we've been able to provide through the platform is a kind of population view to the doctors as well of their whole cohort of patients. And, that's been very valuable. And then also, obviously, when we think back to the previous slide, if there are various alerts coming through on any of the wearable devices or any of the other devices that the patients have, one's able to alert the doctor proactively and get him or her to intervene proactively. And then the patient side, again, facilitating the interaction with the doctor or other members of the care team. It's not just a doctor game, this. There may be case managers and other people, coaches, as I said, that empower the patient. So really to get the two parties to work together.
And would you say the doctors, because of the system being so more proactive, the alerts coming through real time, do you find that doctors maybe struggle with the amount of data that they need to triage because of the alerts, or because normally doctors would wait for you to come in and then respond? Now, obviously, with technology being instantaneous in a way, the proactive data, the real-time data, can that be seen as potentially overwhelming for a doctor that has 6,033 patients? Is he constantly looking at his screen?
So you raise a very important point, Raj. We haven't seen that yet, but obviously one needs to guard against information overload. Just as one needs to guard against knowing too little, one needs to guard against knowing too much. But again, I think the point here, it's a team game. Okay. So these things might not need to come directly through to the doctor. There can be other members of the care team who can perhaps, as you say, triage or evaluate that information coming in to the doctor. So not everything needs to get passed on to the doctor. So I think, one needs to have that view of the world as well.
The support from the case managers
Absolutely.
Absolutely. And I see you've selected a particular device to support remote care, which I think is, I think that maybe talk about the decision and how you got to choose Taito.
So we looked around, extensively, and this device really, we did quite an extensive analysis. We were hugely impressed by the clinical quality of the sounds and the visuals that this device is able to deliver to the doctor or the other healthcare professionals. And so, as we said, there's certain face-to-face things that one in the past felt how do you examine a patient's ear if they're not sitting in front of you? How can you look down their throat or listen to their heart sounds? And really the clinical quality of both the visuals and the auditory messages that come through the Taito device hugely impressed us. So we've introduced it as of this year as another adjunct in the system. So, either the parents, caregivers at home or lower level clinical staff in a clinic can use this device and transmit these kinds of images and sounds through to either the family practitioner or to a panel of doctors set up to support these devices with the information coming through. And that really enriches and enhances the consult hugely.
And these devices, are they part of Vitality or Status, or is it a purchase process for the beneficiary?
So patients, members do purchase them, but we have for people who would benefit, most people living with certain chronic illnesses, etc., families with young children, to prevent you from having to rush out casualty at 2 a.m. with a kid who wakes up screaming with a sore ear. We are supporting and co-funding devices as well. So depending on one's clinical status, the Discovery is co-funding these devices for our members as well.
That's amazing. Do you say that this type of integration with devices, besides I think you started off with the Apple iWatch. I think that was your first one in terms of patient managed, not at wellness days with a whole lot of other devices. Would you say that remote monitoring is a strategic pillar that you guys are going to pursue going forward to really sort of provide that real-time data?
Definitely. As you said, it needs to be managed, it needs to be triaged. You don't want to be flooded with a lot of irrelevant information. So there's a whole lot of skill required there as well, and intelligence. But without doubt, this remote monitoring, if you think of arrhythmias, you think of those kinds of things, remote monitoring can really transform the way that certain diseases are managed.
I agree. So looking at the impact to the larger community, I think this
is just an example, as I said up front, Siraj, this isn't only for the members of the Discovery Health Medical Scheme or the other schemes that we administer. It's very important. In fact, underserved communities and poorly resourced communities should stand to benefit more from virtual care and all the advances and the access to medical skills that they can bring. And so here's just an example. We're piloting with Glokomela. It's an NGO in the Bushbuck Ridge area with farm workers and other workers, to say if we provide TATO devices in their clinics to enable them to access doctors and other healthcare professionals, just to see and prove the kind of benefit that these devices and that virtual care and connected care can bring to underserved communities, which really in the context of the country as a whole is hugely important.
And I think that's actually an important principle about using the best of technology. I mean, your technology is world-class and allowing underserved communities to access remote care services, which I think is ultimately what telemedicine was aimed for. It wasn't designed for the suburbs mom only. It was actually designed for people in far clinics in rural communities needing to see a specialist in a tertiary facility. And I think this is ultimately where telemedicine should be expanded and empower more patients, because we have such a huge disparity in the wealthy and the not so wealthy.
Absolutely. I mean, for our country as a whole, this is critical. As you say, the aim or the objective of virtual care, connected care, is really to bring better care to underserved communities, but it does need to be managed. You want to use virtual care and telehealth to reduce the inequities, not expand them. And for our country in particular, it's very important that we focus on that as a whole. But we do believe that the rising tide will certainly lift all the ships. And definitely we need to focus on applying these kind of technologies, in underserved communities.
And I'm sure, and I know that your role in government from the very beginning has been very proactive around the support and the response to the COVID pandemic. So things like this will obviously support the NHI strategy, which I think
Absolutely.
understands that there's limited human resources and technology is the only way to be able to meet the needs of our entire population.
100%. I mean, if you look at the efficiencies that appropriately used telemedicine can bring to our system, you mentioned, the huge shortage we have of doctors, particularly specialists, but all health professionals. If we could use that critical base to serve a much bigger portion of our community through, as I say, teamwork, appropriate triage, the use of technology, whether you go to NHI or universal healthcare, these technologies appropriately used can definitely, support all of that. Our small but excellent doctor base can then really serve a much bigger part of our country.
No, I fully agree. And I think what's going to be exciting about this next slide is the incorporation of local technology partners, which I think is really impressive, because the company of your size, I'm very sure that your due diligence, your quality standards are extremely high. So for these companies to have made the grade is a great recognition for where South African digital health technology companies are. So
100%, Shiraz. And I mean, just to explain the slide, I mean, going horizontally across it, we honestly believe that building an integrated healthcare platform will support the whole gamut, from wellness to prevention, diagnosis, treatment, ongoing management. And then if you build up, from the layers that we've talked to, the data sources, the analysis with or without artificial intelligence, electronic health records, and then a range of functionality to support patients and to support members even before they become patients, and to support the population, using a combination of our own system capabilities that we can build ourselves, and then a range of best of breed partners wherever possible, obviously preferring, local input for a number of obvious reasons. And really, as I said before, in a number of ways, this is a team game.
Yeah.
And not only looking at involving the patients and other health professionals, but utilizing other centers of excellence in the country. And as you know better than most, we have some brilliant ideas and entrepreneurs and startups, and the more we can do to encourage and incubate and grow those, it's good for everybody.
Sure, and I think the next aspect of COVID is obviously going to be the vaccines. I know that pre-vaccine it was about screening and the PCR tests, and now it's obviously about the booking for your vaccine and creating an orderly process. I mean, I stood in the queue for your health worker vaccine, etc. But I'm sure that with your members, it is going to be an enhanced experience, because your member experience and the convenience that you're going to offer is going to make the vaccine uptake higher than normal.
Absolutely, and we've already. I mean, I'm in our office here at 1DP. I'm one of only 10%. The vast majority of our people are still working from home. As they have since even before the lockdown. We were very proactive, in looking after our people. But I can tell you that this whole building, as have our other offices, has been kind of reconfigured. I have to park in a special place now. We really totally geared up to deliver the vaccines to our members, and obviously we'll play our part in delivering those more broadly than our membership as well. So we're not focused only on them, but really whatever we can do to help the national effort, to roll out these vaccines as quickly as possible, we totally geared up to do that.
Sure. So I think that wraps up your formal presentation. So I think from my side, I'd like to firstly thank you for taking the time, and just on the way forward, are you expecting to see a positive impact with regards to virtual care or digital health through, for example, you track through your vitality process? I assume vitality took a bit of a dip. Nobody went to gym and nobody did screenings, etc. But in terms of your prediction, is that going to be a way to improve overall wellness through virtual, as opposed to just treating those with disease?
100%, Shiraz. Even pre-COVID, I mean, as you know, that was one of the foundational building blocks of discovery and vitality was proactive. And in fact, during COVID, we did lower the kind of threshold levels of the goals that people needed to achieve to, achieve their various targets and goals. But we got quite creative as well in terms of encouraging in-home exercising and pushing that to members as well. I mean, there's fantastic home-based wellness programs that one can get involved in, and we did a lot to encourage that as well. So that's definitely going to be on the up and up going forward.
Yeah, no, I just also want to sort of say thank you for the role discovery played in my career. I mean, I was one of the first to go to the MedTech San Francisco tour with Penny and Shelley back in the day. And I remember, there was a large team of us that qualified to go. And I think Discovery for years have always supported startups, entrepreneurship, and also with the various tours, be it San Francisco, Israel, etc., or Europe, or Asia, that you wanted to create an exposure, because international standards can easily be replicated within the South African context. It doesn't have to be an American solution that solves the African problem. So I think those type of initiatives are also something that maybe Discovery never had enough credit for, of actually supporting digital health startups, medical device startups, and taking them internationally for them to be able to see that the gap isn't that far. And then once they get that exposure, they can understand how to close it and also become sort of best of breed.
100%. I mean, although, as you know, Discovery has expanded globally, but we look at ourselves as a proudly South African company. Our roots are here, our homes are here, and definitely, we back our people. And exactly as you say, we believe that if we can give them the exposure that they need to get, there's nothing that we can't do here. So exactly, I mean, you've articulated better than I can. Just to say that's a part of our ethos, and the more local content and local excellence that we can encourage and embrace, as you saw in that last picture, we're certainly going to be doing more of that.
Yeah, so I just want to also encourage startups to realize that it's a journey, and there is opportunities within South Africa to land a big contract. And ultimately, investors look at traction and they look at effectiveness and impact, the purpose of what you do. And companies such as Discovery are always going to be on the lookout for solutions that meet the needs of the demand, because people their habits are going to change. And I think with grocery deliveries, with food deliveries, eventually medicine deliveries, people are going to change their habits, and that's how they're going to improve access ultimately. And I'd like to sort of just acknowledge Discovery for always being entrepreneurial and proactive in the way they look at the South African startups.
Good. Thanks, Siraj. Thanks for the opportunity.
No, it's a pleasure. Thank you. Goodbye, Maurice.
Cheers.